Hey, welcome back, everybody, to the ABC News 4 furnished room over the garage, better known as my house. All right, it's Tuesday, so that means it's two things. It's Taco Tuesday, and it's also the day that we talk to our ABC News 4 medical expert. That's Dr. David Geier. He has been talking with us remotely, and tonight we're talking a little bit about isolation and mental health. Dr. Geier, first talking about those two big words, mental health and isolation. How are people dealing with that right now?
People across America are struggling with loneliness with the stay-at-home guidelines and social distancing restrictions. And we know that isolation can have harmful effects on people's mental health, leading to conditions like anxiety, depression, and even thoughts of suicide. That appears to be one of the key reasons that many people are choosing to hang out with one or a few close friends. The thinking goes like this: what if we create a closed circle of friends who are all healthy and we only hang out with each other?
So the question is, would you find that to be a safe and acceptable practice?
This closed circle of friends strategy isn't as good as you might think. The main problem is you just don't know where your friends have been. You may trust your friend, but do you really know how healthy the friend or friends that they've been seeing outside of spending time with you, how healthy they are? And truly, if they've been able to avoid exposure to someone actively infected with COVID-19, the data shows that asymptomatic people can transmit the virus. Plus, if you are exposed to elderly, immunocompromised people, maybe you're a healthcare worker, you shouldn't do these kind of hangouts at all.
All right, so the big question, I suppose, who can you spend time with and how frequently?
If you are going to spend some time with someone who lives outside your home, try to find someone with a similar level of risk. Maybe you work from home, you want to spend time with somebody who also works from home, not, say, an emergency room nurse. Plus, you want to have one person you spend time with. You don't want to have one-on-one hangout sessions with 3 or 4 different people. That defeats the whole purpose of social distancing. Also, keep in mind the 2 to 14-day incubation period of the coronavirus. So you should probably make these hangout sessions at least 14 days apart.
All right, so David, Dr. David, last question. What activities would you say would be the safest to do?
As far as activities that you can do relatively safely with your one coronavirus buddy, I'd suggest going for a walk outside, assuming you can stay 6 feet apart. In fact, doing activities outside may actually help your health. The better ventilation may make it less likely that you breathe in some of the virus-containing droplets. If you can't do that, stick to online meetings, FaceTime calls with friends, or Zoom happy hours and book club meetings.
All right, so next week we're going to ask David Geier who his Zoom buddy is, who his mutual coronavirus friend is. So the takeaways here: if you're going to hang out with people outside of your bubble, pick one person. Make sure it's someone who's got a mutual risk. Keep it outside, keep it a distance, and if you can, keep it online.